The big beautiful bill got signed into law. So today we're going to do a little bit of a deep dive into Medicare and the changes happening to the healthcare space going forward over the next 10 years now that the big beautiful bill got signed into law. I've received many calls from many of my Medicare eligible folks, completely horrified and scared that they're about to lose their health coverage. So before we go into anything else, hi, this is Jen, your Medicare and retirement guide. This is going to be an ongoing series because the BBB will be contested in the coming year to go ahead and fix up, change, or contest, as I said before, some of the changes that are happening in the healthcare space. Now, if you like this information and you find this information useful, please go ahead, like, subscribe to the channel, comment down below in what kind of videos you would like me to go ahead and cover in the future. But with that, let's get started. So one of the things that I really want to go over is what traditional Medicare is. So on this channel, we have covered multiple times what traditional Medicare is. And if you haven't checked out those videos, go ahead, click on my Medicare 101 and the differences between all four parts, A, B, C, and D. But for right now, we're going to focus on A and B. Now, one of the things that I really want to stress is that Medicare does not function the way that a regular commercial insurance does. For those who don't know, a commercial insurance is something that an employer would go ahead and give to their employees. This isn't the, oh, after I hit my deductible, my insurance is going to cover me 100%. Medicare does not work that way. Medicare is divided into two main parts, A and B. A being your hospital and B being your ancillary services. So remember, when you have a regular job, insurance has a yearly spending cap. And then once you hit that 100%, the insurance plan will go ahead and take over. Medicare does not work the same way. With original Medicare, there is no yearly cap. You have to remember that you are responsible for 20% of the bill after you hit the deductible. When you hit that deductible for the hospital bill, when you hit that deductible for your Part B, you, the consumer, are responsible for 20% of the bill. So how does that affect you with the BBB? Now, the BBB doesn't structurally change Medicare's A and B. It does not change the structure and the administration of it. But what it's going to do, it's going to reduce the funding of it. So how does that affect somebody who is on traditional Medicare and does not have a Medicare Advantage, which is Part C, or a Medicare Supplement plan, which would be the secondary insurance that helps pay for traditional Medicare A and B? Well, the way that it's going to indirectly affect those who have A and B, there's no cap. Remember, once you hit your deductible, it does not cover you 100%. It covers only 80%. And with those reductions in reimbursement that is about to hit your primary care physicians, your specialists, your labs, and all the ancillary services that you rely on to go ahead and maintain your health, they are going to pass that cost over to the consumer. So remember, if the reimbursement of all of these ancillary services go down, these facilities will either shut down because they cannot keep up with the rapid cost of inflation and percentage increases on like just cost in general and rent increases. Therefore, they will go ahead and pass that cost on to the consumer. Now that consumer who isn't on a Medicare Advantage plan or has a Medicare Supplement plan will see a much larger bill in that 20%. So that is something to keep in mind, that you will either get reduced services or more providers will now deny or will refuse somebody who is on traditional Medicare because they can't make any money. Simple as that. If doctors still have a private practice, it is their right to dictate what kind of patients they want to see. So that is definitely something that you have to keep in mind. Now, you have to also keep in mind that original Medicare does not cover dental, vision, hearing. Those costs will go up if you do not have a separate DVH plan or you are not on a Medicare Advantage plan. All of those providers that used to take Medicare will now have to offset the lower reimbursement costs from the government due to this bill and put that on the consumer. Though it's a prediction of mine, it is not set in stone that they will do this. I would not put it above or above them. These providers will go ahead and put the costs back on the consumer. What do you mean about this 20%? What happens? What do you mean I have to still pay an additional 20% and the doctor can put their bill? What does my deductible do? Your deductible is what it's called, a deductible. I'm gonna round it up a little bit, but $1,700. It's $1,690, somewhere around there and change for Part A. So you end up in the hospital. But remember, every single part of the hospital has a different bill and different ways that they bill according to what category they fall under. What do I mean by that? So if you go to the hospital and you know you have that $1,700 deductible, however, you get lab work done and the lab work falls under Medicare Part B, then you will have a separate bill on top of that. That's why some folks, when they leave the hospital and they say, what the heck, I have Medicare A and B, how do I have a $3,000, $5,000 hospital bill when I only have a $1,700 deductible and a $250 Part B deductible? Well, remember, Medicare is not commercial insurance. It does not cover 100% after you meet your deductible. It is, you pay your deductible plus 20% of whatever's left over of the bill. So once they reduce that $1,700, once they reduce that $250, from there, they will grab that 20%. They will pay 80%, which is the government, and that last 20% will now fall onto your lap. Now, this does not cover the excess Part B costs, which medical providers right now do charge. Now, not every medical provider has an excess charge for Part B, but in the way that the bill was passed and in the reductions that they are claiming are going to go into place over the next 10 years, it will become common practice for doctors to go ahead and put in an additional cost, an excess Part B cost, and that will be passed on to the consumer. Now, in terms of prescription drug plans, those were still left largely unaffected just because it is the Part D was touched by the Inflation Reduction Act that Biden put into place back in 2022. One of the changes that are apparently coming up for 2026 is that instead of the $2,000 deductible, it will now jump to $2,100. Depending on when you're seeing this video, it may have jumped up more from there, but at least now in July of 2025, we have gotten wind that the deductible is set to increase an additional $100 for that prescription drug plan deductible cost. Now, I'm not surprised personally that they increased it. It's been a very challenging year navigating the different prescription drugs and what companies are willing to cover versus not cover in terms of their formulary and what category the prescription falls under in the tier system. What can you do going forward and how can you afford to pay for all of these costs? Now, I know a lot of my beneficiaries, you know, when I encounter them and they ask me these questions and they are turned off by a Medicare Advantage plan, or they're shocked by the cost of a Medicare supplement plan. Ultimately, from the way that they are gearing in terms of the funding towards Medicare, it is looking more like they are trying to aim folks towards the Medicare Advantage space. My prediction, don't come for me, I am guessing, but it's giving me personally the impression that they want to privatize a lot of the healthcare industry. The government no longer wants to manage Medicare A and B. They are reducing the cost of it, meaning that they are pushing providers more and more towards getting enrolled by different insurance companies to go ahead and accept the multitude of Medicare Advantage plans and become more managed care. Now, my opinion, whether that is good or bad, who's to say? I have had plenty of success stories of folks who thank me for putting them on a Medicare Advantage plan. I've had plenty of folks thank me for putting them on a Medicare supplement plan. And then I've had a couple folks that I have been very honest and I have suggested, you know what, stay on traditional Medicare. Don't sign up for either one. But know your rights and know the contract that you're signing. If you choose to stay on traditional Medicare, be aware This is what the bills will look like if you end up in a hospital, if you end up in emergency department, if you go to a specialist, if you have surgeries. Be aware. With that said, those on Medicare Advantage, they know their contract. It's written by the insurance company, therefore they will always have their summary of benefits and evidence of coverage. Same with a supplemental plan. Supplemental plan, pretty straightforward. Whatever Medicare agrees to pay, they must also comply and cover the rest, depending on which Medicare supplement plan you choose. Other than that, I will be following this very, very closely. I will be checking in to see what changes, what will be contested, what will be challenged in our courts, in Congress. If you found this information useful, comment down below. Let me know what you would like for me to cover next from the BBB. I know there's a whole section dedicated to Medicaid. I will be uploading a video on that very, very soon. With that said, if you like this video, share, like, subscribe, and always, I am Jennifer, your Medicare and retirement guide, and I will see you on the next one. Bye-bye.